where communities start to demand more engagement in conversations around dementias and brain health, as opposed to us coming in and trying to invite them into the conversation. They're the one who are demanding and guiding the conversation, and that's the best outcome.
Welcome to Brain Bridges, the podcast where we hear from leaders working to advance equity in brain health and explore the journeys that shape their work. I'm your host, Victor Valcourt. Each guest in our series is an Atlantic Fellow for Equity in Brain Health, a global fellowship bringing together leaders across health, science, advocacy, and the arts to improve brain health and reduce inequities around the world. Today we hear from Magda Kaczmarska, a dance artist and creative aging advocate whose work explores the connection between movement, creativity, and brain health. Let's begin.
Hi, Victor. It's good
Magda.
to see you.
It's good to see you. Tell us a bit about where you grew up and how you first came to dance and creative work. Were you born in Tucson?
No, I was born in Poland. So I was born during when Poland was still in communism. So it was under martial law. So that's when I was born, in the 80s, behind the Iron Curtain. So my journey to Tucson it took a while. So my biological dad left first. His family got him out of Poland, and I didn't meet him again until I was in my 20s. And then my mom and my stepfather left when I was like 2, and I stayed behind. And I was raised by my grandmother, and she influenced a lot of my passion. And in 1991, that was when my parents were able to get a visa for my grandma and I to come over to New Mexico. My mom and my stepdad are both geologists. So at 8 years old, I went from Poland to southern New Mexico, Socorro, a tiny little town, didn't even have a grocery store. And then we went to Tucson, Arizona when my stepdad got a job at the university. So yeah, that's how I ended up there.
You actually were a scientist in your undergraduate and even afterwards working in research.
Yeah.
Tell me a bit about the tension between being a scientist and being a dancer.
That's a very good question. And that tension, I think, is the right word that I would use. I know I danced a lot when I was in my grandmother's apartment, but when I came to the States at 8, I remember that was the first time I got exposed to ballet. And I remember telling my mom at 8 years old, "Mom, I want to be a ballet dancer." The reality of being a child of 2 immigrant grad students is that is a very expensive hobby. And that wasn't a possibility for my family. Looking back, I know my mom had a lot of sadness about that, but I really do believe that there's a serendipity to the way that life navigates you, because that passion for dance never left me. I just came to dance a little bit later in life. I started dancing when I was 13 in folk dancing, and it really saved my life. And I was a very shy kid. I was shy even in Poland, and especially coming to the States, having to learn a new language. It's a big culture shock. I didn't want to speak in class. I thought I had a very strong accent. And so I really receded into the background. And then I started to dance, and it was like this whole other person came out. I found the language for myself. And I think that stuck with me. But the reason I went into science was twofold. I always was fascinated with the human body. I wanted to be a doctor when I was a kid. And my parents are also obviously scientists. So there was definitely pressure to go into the sciences, but I love biology. And I actually got a scholarship to go to school to study biochemistry and molecular biophysics. The classroom stuff wasn't as much fun, but being in the lab was super fun. I think I'm a kinesthetic person, so actually being able to make science tangible was really exciting. I love the problem solving of it. The fact that you're getting to discover something that is going to transform people's lives, I think is infectious. And I think initially my thought was, I'm going to do the practical thing. I'm going to work in the lab, and I'm going to dance in my spare time. And I did that successfully. Just out of college, I was running a research lab, and I was at the same time leading dance programs in the community. I started an adult ballet program, and I just started to see this impact that it was making in people's lives. And I thought, this may be where I want to do. So I kind of made a crazy whim to switch my life around.
How has that been for you in terms of that choice?
It took me many years of thinking about that and also speaking with important mentors before I made that decision. And I felt that the time was right. I had a phenomenal, incredible boss in my research lab, Dr. Patrick Manti, brilliant individual who, when I came up to him and I told him I wanted to go to pursue my MFA in dance, I was so scared. I thought he was going to look at me like I had grown two new heads. And instead, he said, it's so rare to find something that really gives you passion. And it's clear that this is something for you. So anything I can do to support you, I will do it. And receiving that level of support and encouragement from him was just the green light. And I also had some really great advice for artists. One of my dance teachers said, when you're looking at jobs, look at three things. One, is it advancing your network? Is it making you money? Is it giving you joy? If you're lucky, you'll have maybe two of those, but usually you only have one. And every once in a while, you'll have all three, but it's very rare. And so setting your expectations for the fact that it's not always going to be easy, but finding a balance in between. I understand that there will be fluctuations, and that helps me stay steady. I'm actually grateful because that scrappiness has served me really well. And then means that I can do a lot with very little. There have some sacrifices that I have to make.
Tell me a little bit about this nonprofit that you're developing.
Yeah.
What are you doing?
So it's an arts and health nonprofit called DanceStream Projects, and it's all about dance and brain health. And it's really grew out of GBHI. So my pilot was to do a research study on a dance program with people living with dementia. And starting and working with that community was like, there's something here, right? It's not just my vision and my desire. So the work started with a program. That program, actually, just earlier today, we had a program with the same community that we first started with. So now it's 6 years strong. But that community started to grow into more communities in person in Queens, in New York, where I live, then expanding across the city. And then other teaching artists started to join in. And very soon I started to see that it's not just me. Now it's starting to turn to a community. There's a community of other artists that are adding their voice to this work. There's a community that's really hungry for engaging in dance in this way. And there's also a global community that's recognizing the value of this work. But I feel that there's a need to have more voices in the space. And I feel like that's what we're doing. We're also doing a lot of educational work to be able to lean on that knowledge and be able to use that to guide conversations in communities and leverage the trust that we cultivate with communities to start developing brain healthy habits and to enter into the conversation of dementia sideways. Because there's a lot of stigma, and sometimes we need to guide people in so that they're more comfortable having new language around that and embracing it. And that, I think, has the opportunity down the road to really start to shift into social change, right? Where communities start to demand more engagement in conversations around dementias and brain health, as opposed to us coming in and trying to invite them into the conversation. They're the one who are demanding and guiding the conversation, and that's the best outcome.
Can you speak more specifically about how creative expression complements or can solve problems that clinical care can't?
I think it's more of a collaboration. I think they all center around care. And I think we have a tendency as a society to look at limitations and conflate them into totality. And I think we need to be realistic about limitations, and that some of the limitations that people perceive from clinical care doesn't come from clinical care, but from systems that hinder how much time people are able to spend with one another, and financial limitations and restrictions that don't prioritize and value human connection. But that's not clinical care, that's a systemic issue. I actually think that there's a lot of similarity. There's a lot of creativity and curiosity that I've noticed and perceived from clinicians that they bring to a relationship with their patients. I think that what we do when we work in communities with through the arts and dance particular is exactly the same. We come in with curiosity. We start with establishing a connection and asking for the privilege to join into space. We cultivate a shared space together. We center trust and respect, and we lean in with curiosity and a certain level of experience that allows us to meet people where they are and then curate experiences that we kind of build initially in observation and in response to what we perceive. But then over time, it ends up becoming a reciprocal exchange where the communities and the individuals that we engage with respond and nurture what we then bring in response. So I feel like there's a lot of similarity. One thing that I do think is a specific strength that I perceive I've learned from working with brilliant artists and cultivating a craft of my own is the embracing of limitation. We have these negative connotations with scarcity, limitation, but I actually have found that either sometimes receiving a limitation or a hindrance from an external source, even initially it might seem like something tragic, actually, in the end, usually has curated opportunities for me into new spaces and arenas of growth that I otherwise would never have gone into. So to me, those limitations are sometimes blessings and gifts. And I also use limitations very intentionally in working with people living with dementia, with other teaching artists, also with myself. Sometimes looking at the totality of something is overwhelming. And when we create a smaller container around it, suddenly that the opportunities for new ideas just burgeon and burst and flourish. And then we can start to expand or maybe have smaller containers that then we can put together. So it's that limitation, I think, has been something that can continue through my life. I wouldn't be here today if it weren't for them.
I'm supposed to ask you if you consider yourself a leader. Maybe I should ask you more about what does it feel like to be considered a leader?
I'll be honest with you, I struggled with that term. I didn't see myself as a leader. I've always felt more comfortable uplifting other people's ideas. I lacked confidence in myself to think that my voice was important enough to take up space. But I realize now that I think that was also a limitation on how I saw leadership as somebody who's really loud and upfront or takes up a lot of space. And now that I'm here, I'm realizing that I am a leader. I still am not very comfortable with that term, though. I love people and I love understanding people. And I love more than anything to see people witness how brilliant they are and to discover a talent or something about themselves that they've always had and they didn't even know they had. And then to see how much joy that brings them. That makes me tick. It's initially why I wanted to go into dance because I saw how much joy I could bring other people by guiding them into a discovery of dance for themselves. But now I'm finding I'm really enjoying that in other arenas, whether that's engaging in brain health, whether that's helping other teaching artists and dancers find ways to find their voice as a facilitator of this work, actually working with researchers and finding a shared language to help us better understand how to expand access and resources to this magical superpower that dance is for brain health. And I think also part of it is I don't think I would do this if it were just for me, but I'm doing it because I see that it's bigger than me. Now I know hundreds of people that we work with on a weekly basis who push me to do the things that I wouldn't necessarily want to do, that I'm afraid to do. I have teaching artists I'm responsible for now. And as much as that responsibility could be seen as a burden, it makes me thrive because it actually keeps me going. I wouldn't do this if it were just for me. I can be honest with you. But this is probably getting really personal. But when I think back on my life in Poland, I always felt like a massive outsider. I was raised by my grandmother and didn't have my parents, and I was bullied by kids in school. And I never really felt like I belonged, but I always felt super lonely. And so I think I initially sought dance out because it helped me find community. And now I feel like I've helped make community. And that, in a way, I know that I'm feeding myself. That's a selfish act, right? It makes me thrive because I'm so hungry for it. But I also see how much joy it brings other people. And so I guess, yeah, I'll take it. If you want to call me a leader, sure. But I guess I'm more of a connector. Yeah, I'm a connector.
Since the very first day, we believed that leaders needed to have a set of values and that the values will stick, whereas the skills will change. So authenticity, fairness, openness, respect, courage, and empathy. Which one of these values most links to you? You feel you resonate with the most?
I actually feel like for me, the primary one is authenticity. That's the one that really drives me because without authenticity, the other stuff isn't really possible. And for me, authenticity means first doing the work to figure out who you are. I took 8 years of my life to do that. Part of the reason I think why I was blessed to have the opportunity to work in a research lab is that I used a lot of that time to focus on figuring out who I was. I had a lot of trauma and it affected my sense of self. And by the time I was in my 20s, I had an eating disorder and I had no idea who I was. I was a people pleaser and I just tried to shapeshift into trying to avoid conflict and to just figure out how to stay afloat. But that is no way of living. And I really came to a wall. And I mean, I know it sounds really drastic, but I came to a point where like you could end it here or there's something else. And I felt, no, there was a voice that said there's something else. And so I did. I spent many years trying to figure out who the heck I was. And in order to do that, I had to first strip away all the things that I thought I was, but actually weren't. And that's a painful experience. That vulnerability of sitting and not knowing who you are and feeling that you're more like a Swiss cheese is how I thought of myself. I'm more holes than substance. And initially, how I did that was sitting in rooms with examples of people who were very vulnerable, very honest with their mistakes and their failures, the good, bad, and the dirty. And I learned from them the kind of person that I wanted to become. And then I acted that person into being. I made a commitment to myself that my values are the most important thing. You know, I may not have money. I may not look very good. I can't control my environment, but I can control how I act. I can control how much I'm in alignment with what I feel is right. And I can always learn. I will always make mistakes. That's a given, but how can I learn from them? So to me, that's authenticity. I think for many years, I had a big chip on my shoulder because I felt like I was behind all of people who were the same age as me. But in those 8 years that I spent really building out a path for myself, guided by other people, really examples of brilliant individuals who were living their best authentic selves, that has served me. That's the engine that has driven me to be here today. So yeah, finding that authenticity is a gift. And it's not easy, but God, it's the thing that keeps me here.
If there's one thing that you would want to share with our listeners, Magda, about brain health and what people can do, perhaps around your work and creativity, what would be the one thing you'd want to share with our listeners broadly?
Well, I'm going to break a rule. I'm going to do two things. One is I'm going to refer back to something we talked about earlier. Embrace limitations. Be willing to look at mistakes or perceived challenges as an opportunity. And the second one, dance. Put on some music and dance. It's the best. It's not the best, but it's wonderful for your brain health. You can dance without music, but the music and dance are a wonderful thing together. As one of our brilliant UCSF researchers, Dr. Caitlin Castelletto says, it's the trifecta. You've got physical activity, you've got social connection, and you've got cognitive stimulation. So you're getting three things with one activity. Even just 3 minutes is going to change your mood, I guarantee it.
That was Magda Kaczmarska, a dance artist and creative aging advocate whose work explores the role of movement, creativity, and connection in brain health and aging. If you enjoyed this episode, please share it with a colleague, friend, or student interested in brain health and equity. Brain Bridges is a production of the Atlantic Fellows for Equity in Brain Health at the Global Brain Health Institute, University of California, San Francisco. Production support is provided by Podfly. Podcast artwork by Atlantic Fellow Kugundu Rodney, with design by Carolyn Prelo. I'm Victor Valcour. Thanks for listening.